I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to go over how to foam roll your back. That is your lower back and your upper back. This is a great way to fix your posture in about a minute or less. Now, granted, it's not going to solve everything, and you're going to need to take some steps in order to be able to maintain what the roller does. But if you're looking for that quick fix to fix your posture, this is definitely going to help you do that. It is not going to solve everything, like I said, but this will really help get things straightened out and break up some tissue. Now, I do want to caveat this, as I get this question a lot, and I get people who come in here and have foam rollers that they don't ever use, and they're collecting dust because the foam roller is so painful they can't use it. So there's a lot of variations to do foam rolling with. So this one that you always see me with is spike. We are very into spike here. So it's the hardest foam roller you can get. Even a PVC pipe does not do as much as spike does, but it's extremely aggressive. And most people, when they come in here, unless they're a runner saying, I got to run a race in a week, we're not going to get them right onto spike. You can get a flat foam roller that you can start with. And what you want to do, and what we're going to go over tonight, is some things that you can do to open up your back and to really help release some of the tissues in your back. But what you want to make sure that you do is that you find the appropriate foam roller for you. Not doing it is not an answer. So if you sit on a foam roller and it's really, really sore, push up on your hands, push up on your legs so that all your weight doesn't bear down on the foam roller. If you get on a foam roller and it hurts too much to do a foam roller, that's exactly what you should be doing. You should be seeking treatment also at the same time in order to help relieve a lot of that stress and tension and knots that are in your muscles. But if you wind up sitting on a foam roller or you start foam rolling and you're like, I can't even do this, this is so painful, I'm just going to put it aside, it is telling you it is exactly what you need to be doing. So find a foam roller and practice these techniques that we've been showing you and that we've been going through. And if you are not able to do it, you need to seek treatment. So you need to be in our office so we can get you to foam roll. Foam rolling is an excellent diagnostic tool as well as an excellent tool to help you feel better. And what I mean by diagnostic tool is that if you sit on spike and you feel trigger points and you feel pain, that's an area of dysfunction. This should feel good. This should feel like a really deep massage. And you're probably going to feel trigger points every day, depending on how active you are. It's not a bad thing to feel a bad spot and roll it out and have it be gone. That's okay. You're going to catch something on this roller. You're going to catch a knot. You're going to figure out there's something going on that's dysfunctional in your body from the roller well before you will ever feel it. So this really helps allow you to feel things that are going on in your body that you actually aren't able to feel yet. I always recommend people have 2 foam rollers, one with these spikes in it, not ridges, not anything, not PVC pipe, but spikes, and then one that's just a plain foam roller, flat, no frills, not hard. So you're able to do that in periods of time that you may be sore or you may not be able to tolerate this. The worst thing you can do is to stop foam rolling because you're too sore, or not do foam rolling because it hurts too much. So literally, this is the 60-second posture fix that I'm going to show you. It's going to take me a little bit longer than 60 seconds because I'm going to walk you through it. But when you get really good at it, it's going to take you less than a minute to do this, and it's going to help loosen up your back so you're able to tolerate a better posture. So you want to do is you're going to start on the floor, and you're going to sit right on your roller. This is the basic starting position, all right? Now, if this is too painful and you can't tolerate this, put your hands back, push up on your feet and your hands. So now I'm barely touching the roller, and a lot of times this is enough for people. You will get an ab workout, you will get an arm workout, that's okay. Take little breaks, you don't have to do this all at once. You're just going to roll back and forth, nice and slow. All right, you want to go from all the way to the bottom of your glutes to the top of your back. Nice and easy. Now, when you get really good at this whole thing, what I'm going to show you tonight should take you about 60 seconds. Now, if you don't feel anything, like this just feels like something's rolling underneath your bottom, that's okay. That means there's no knots there. You still want to stay on there for about a couple seconds just to make sure. Now, what you want to do is when you're dealing with your back is you want to make sure that you roll out your hips too. So you want to make sure that you're crossing over and you're going into your piriformis. Again, you're going to go from the top of your glutes, the bottom of your back there, all the way down to the bottom of your glutes. You should not feel any tender points, but if you do, you want to stop and then just stay on them just for a couple seconds. Do not stay on them for a long time trying to break up all the tissue. You will wind up being more sore. So if you have a bunch of them, just pick like 3 or 4 spots to do. You want to lean towards the side that's crossed, and you also want to make sure that this is comfortable. If this is unbearable, again, push up on your hands, push up on your legs. Go nice and slow and easy, and don't have so much pressure going onto the roller. Then you're going to move to your low back. So you're going to start here, all right? And again, nice and easy. You're just going to roll from the bottom of your ribs down to your low back. Nice and easy. Now, if some of you with back pain are not going to be able to tolerate this, that's okay. You put your hands behind you. Now you're just leaning on it just a little bit, and you do this. It's nice and slow. It's nice and easy. If you have a shirt or a ponytail or something, just be careful. It might get caught. So all you're going to do is then you're going to go up towards your ribs, all right? So up, and you're rolling your ribs right now to the top of your shoulders. Do not bring this onto your neck. You never want this to go onto your neck. Your neck's not going to be able to do it. You can also bring your arms behind your neck to give your neck some support. And you can bring your shoulder or your elbows together like this and then roll. Bringing your elbows together is just going to open up your shoulder blades a little bit more and allow that roller to really get into that back area, that upper spine area. Nice and easy. Again, if you can't tolerate this, just put your butt down, okay? And inch your way up nice and easy without picking up your butt. All right? You're going to get pops and cracks. You can't probably hear them, or maybe you can, but my back sounds like the 4th of July. That's okay in order to be able to alleviate some of that pressure. In order to be able to break up some of those knots, it is perfectly fine to hear pops and cracks. If you feel numbness or tingling, that is not okay. You need to come in here and consult us and see what's going on. That's the sign of a problem. Do that for about a minute or two every day. You're really going to see an improvement in your posture because you're going to be able to sit up. You're going to be able to maintain the correct muscle length in order for you to have good posture.